when you approach your home exercise program or working out in the gym or anything like that, you want to change your approach to sets and reps. I've talked a lot about this before in different formats, the idea of kind of inverting your rep scheme. A common rep pattern is 3 sets of 10. People go in, do their 10, rest, so on and so on. With rehabbing injuries and improving motor control and things like that, sometimes inverting that and making it 10 sets of 3, or some variation of it, could be 5 sets of 3 or 6 sets. But the idea is keep your sets brief. It allows you to focus on your technique, allows you to manage fatigue. If you just focus on 1, 2, 3, sometimes 4 reps at a time, I use this strategy all the time when dealing with pain and rehabbing injuries for people. They can focus on 2 reps at a time. Have them do 10 in a row, different story. Subtle things will shift in the ability to control joint positions, the ability to hold the body position, to keep the right muscles active. But for 2 reps, they're good, right? Sometimes what you want to do is almost break up your set into mini sets of 1 rep. Do a rep, reset all the little pieces that go into setting up that exercise. If you're doing a lunge, for example, make sure that each time you come back to the start position, you get your foot in the right position, you actively think and focus on the right muscles, your upper body's in the right position, but do them 1 at a time. And to kind of dovetail that, think about doing 1 less, not 1 more. Right? So a lot of times when we exercise, you get to that juncture in the set where you pause and you're getting all geared up for that 1 last rep. When you're rehabbing an injury, 1 less is better than 1 more. So if you get to that point where you're starting to feel like, well, maybe I could do another one, nope, you're good, done, cap it, move on to the next thing. That 1 extra rep is not going to make or break your rehab in a good way, but it could set you backwards a little bit. If you lose balance or lose technique or move a certain way, you can absolutely flare things up towards the end of your set, especially as the muscles fatigue. You may not feel fatigued, but the muscles may start to fatigue, which means they don't stabilize the joint the right way, or they don't initiate the movement in the right way, and that can feed into some inflammation, some irritation, and all that does is delay you getting better, and you're trying to get better quicker. Everybody wants to be better yesterday, and I get that. So you have to take the right approach to allow the body to heal. Sometimes our job is to get out of the way, right? We can't always accelerate the process, but we can slow it down, and a lot of people are very good at slowing it down. So get out of the way, let the body heal, and do what you can to facilitate things, but try not to overdo it and understand when to do a little bit less. That 1 less, not 1 more idea is great if you couple that with inverting the rep scheme and keeping your sets and reps. Well, you can do more sets, keep the reps brief, and repeat as many as you need to get the job done. And it might be, don't be afraid to do 3 sets of 3 reps for an exercise. Nothing wrong with that. If you can go through pain-free range of motion, there's no increased pain by the end of the set, and you complete all 3 sets of those 3 reps, then you're moving in the right direction. Versus doing 3 sets of 10, having your range of motion decrease slowly and have your pain increase as you move through that, that defeats the whole purpose of what you're trying to do. So focus on some of those things. If you need any help, reach out via ebmfitnesssolutions.com, info@ebmfitnesssolutions.com, or Facebook, Instagram. I'm all over the place. We'll talk to you guys soon.